Hello, I'm Dr. Nagaraj B Puttaswamy. Life after gallbladder surgery. Generally, what I make a statement is life after gallbladder surgery should be as normal as possible, not as before surgical procedure. Say as normal in the sense as a normal individual. Say gallbladder surgery doesn't cause any sort of change when compared to a normal individual. In the sense, physically, digestively, and also mentally, the patient can be as normal as possible following laparoscopic gallbladder surgery. This is a strong statement which I can make. Should the patient have restrictive diet? Absolutely no. Patient can consume almost every food any other normal individual can consume. We'll tell that patient can go to the West and try and feast on whatever non-vegetarian stuff is there, maybe the Chinese type of food, the Indian type of food, vegetarian, non-vegetarian, everything the patient should be able to normally eat following laparoscopic gallbladder surgery. Again, it all depends on the staple style of food, what the individual consumes. And how early can the patient get back to normal activity? So I try to tell, if it is a planned gallbladder surgery and a relatively easy surgical procedure, it should be a weekend procedure. Friday we do some investigations and try and confirm that everything is fine on the individual. Operate on that Saturday morning, discharge on Sunday or maybe on Saturday evening. Patient get back to normal activity on Monday without even telling anybody, saying that the patient has undergone laparoscopic cholecystectomy. See, in case of complex and difficult gallbladder surgeries, of course, the length of stay may be extended for a couple of days to cover up with good antibiotics, and later on the patient may require about a week's time to completely recover to go back normal. But end of the day, even if it is a complex laparoscopic surgical procedure, if it is done laparoscopically, we can still be able to allow the patient to go back to normal activity within a week or 10 days time. This is about how early you can recover. Advantages of laparoscopic surgery over open surgery is humongous. Open cholecystectomy is done with a subcostal incision. Costal is the costal margin, that is the rib cage, which is the lower end of the rib cage, maybe about 1 or 2 inches below that. We make a lengthy cut like that across the upper part of the abdominal wall. That is one of the most painful incision which a surgical person would inflict on a patient. It's not that whether I do or somebody else does that. Subcostal incision is one of the painful incisions which we make. After that, the recovery becomes that much very difficult. In the hospital, the patient may take about a week's time to recover. To get back to normal activity, it is close to a month. Where compared to laparoscopic surgery, this is very tiring. The blood loss is higher, possibility of infection is higher, possibility of post-operative hernia formation is higher when compared to laparoscopic surgery, where we don't see anything related to this. These are the huge advantages related to laparoscopic cholecystectomy. Gallstones symptoms are generally dyspeptic. We say that gallbladder dyspepsia, peptic disorder is what we are trying to tell about relative. Generally, patient comes with saying that I have significant amount of gastritis. That is called dyspepsia. Gastritis is anything related to abdomen. Patient will straight away come and talk and tell, saying that he has lot of gastric problem. Whether indigestive status is there, whether there is nausea, there is vomiting, there is constipation, loss of appetite, all these are related to gastric for a common man. So gallbladder dyspepsia is because immediately after consumption of food, the gallbladder which is affected with gallstones and some amount of infection, it has to contract. It has some discomfort. Patient develops some amount of discomfort following meal. That is one of the important symptoms what the patient tells. Early symptom I mean to tell. Then the patient would probably feel comfortable throwing. That is, after vomiting, the patient feels it is relieved, because the gallbladder doesn't have to contract and then push the concentrated bile, which is the normal function of the gallbladder generally. So if this is the common symptom, many times the patient will be happy taking antacid syrup or antacid tablet. Patient may say that, okay, I was relieved with some amount of tablets like this, and also a basic antispasmodic painkiller would definitely relieve the symptom. Generally, patients manage themselves on their own with these sort of symptoms. So can these symptoms be completely abolished following gallbladder surgery? Of course, yes. So once the gallbladder surgery is performed, gallbladder is removed, the equation of this pain and discomfort is completely taken off. The patient will be completely symptom free of what the patient was going through. Many a times nausea, vomiting, dyspepsia, regurgitation, heartburn, these are the common symptoms. All these symptoms will be completely done. And postprandial, that is immediately after food, the patient develops discomfort, pain, and particularly if the food is of heavier type, non-vegetarian type, fatty food, the pain would be more aggressive. Patient tries in parties or goes to an event, consumes heavy food, particularly meat and chicken. The patient comes back with discomfort. Many a times I have seen patients coming early in the morning on a Sunday because they would have feasted on the Saturday evening. So these are symptoms which can be easily taken out from the normal activity of an individual following laparoscopic cholecystectomy if it is chosen rightly and performed fair.